Okay, just a real quick video. This is something that I find really interesting. So this was put together by a team of Canadian pharmacists using all of the best available data and studies when it comes to cardiovascular disease and the benefits of different medications. So this is something when you're kind of given a medication. I'm not saying the purpose of this video is not to say don't take medications, but the purpose of the video is for you to be aware of what type of benefits are you actually getting from these medications. Best case scenario. So let's go through it. So everything's with regards to CVD, cardiovascular disease, and then they're talking about what are the different factors. So they're wondering about the effect of blood pressure, your cholesterol levels, diabetes, atrial fib, and then what are some of the benefits if you've already had an issue, like so post-MI. So let's go through it. So best case scenario, blood pressure medications. So if you are, right here, we'll just kind of just do an overview. If you're a man age 50 or a female age 60, and if you have a blood pressure of 140, and you take a blood pressure medication for 10 years, you reduce your risk by a whopping from a 6% risk to a 5% risk. So a lot of times people are like, oh my gosh, I have a blood pressure of 140, I'm going to blow an artery. Your resting risk if you're 50 years old as a male is 6%, and if you take blood pressure medication for 10 years, it reduces it to 4%. So you're dealing with a 2% reduction. Best case scenario, if you're a man who's age 60 and you have a blood pressure of 180, you take that blood pressure medication then for 10 years and you get a huge reduction of 5%. So people make you feel like, they started at 18%, they went down to 13%. Most people, if they go to the hospital with, a blood pressure of 180, they're sending you to the emergency room because they're acting like you're about to rupture, blow an aneurysm right there. Your risk factor for a cardiovascular event, 18%, 10 years of treatment, you can reduce it by 5%. Now let's look at that with regards to cholesterol. If you are so say you're taking a statin medication, you have high cholesterol. If you take a statin for 10 years, you can reduce your risk. If your blood pressure if you're a female, if you take it for 10 years, you get a 2% reduction in risk. And if you're a male, the best case scenario is that you're getting a 3% reduction in your risk. So we're talking about very small benefits. And some people come into the office with a lot of side effects. They come in with some muscle pain, brain fog. And they're like, well, at least it's worth it because I know I'm getting these benefits. And it's like, is it really worth it? Is it worth the 3% risk? Because there have the same studies showing that if you were to do exercise and a Mediterranean diet, that 3% benefit isn't 3%, it's like 5 or 6%. So if you had to choose, what would you rather do? I think the answer is fairly obvious. Diabetes, metformin. So if you are age 55, you're newly diagnosed, you go on metformin for 10 years to help prevent cardiovascular disease, you get an 8% reduction in risk, which is substantial. That is substantial. At the same time, you can also balance your blood sugar the same way without medications if you want to. But this, at least you can see, 8% is your risk goes from 22 down to 14%. Now, this is important over here. If you've already had a heart attack, at that point, using a low-dose statin can, instead of a 3%, you get an extra percent. So you can go from 3% benefit to a 4% benefit. For a female, you're still looking at a 2% change. So again, like you had a heart attack before, like you have to take this, otherwise you're going to get another heart attack again. Well, if you take that medication, you will reduce your risk by 4%. You have to ask yourself, is the 4% worth it for you? So again, the purpose of the video is not to say don't take medications. It's not to say do take medications. It's so that you know what are the actual benefits from taking the medications so that you can decide, is the risk worth it for you?